Sup, it's Philip. I'm going to do my presentation. So the first one I'm going to do is on the circulatory system, and the disorder that I'm covering is varicose veins. And what varicose veins is when the valves in your veins don't open and close properly. So here you have a normal vein, and what's supposed to happen is your blood is supposed to go up the veins, and then your valves are supposed to close so it can't come back down. But when your valves don't open and close properly, usually due to aging, what will happen is the blood will go up and will come down, which will cause in a lot of pressure and a lot of buildup of blood, which can lead to, you can see it, and it usually happens in your legs. You have big purple or blue veins that you can see, and there's really no bad symptoms other than the fact that you can see them and it can be unattractive or whatever. The way that you treat this or prevent it is you just have to stay healthy, so exercise, don't put too much weight on your legs because that's usually where your varicose veins come from, and your feet, eat healthy, and so on and so forth. Okay, moving on. So for my respiratory system, what I decided to do was bronchitis. So here are your lungs and you have your bronchial tube. Now what your bronchial tubes do is they carry air from outside to your lungs and back out. So what bronchitis is the inflammation of your bronchial tubes, and your bronchial tubes produce mucus. So keep that in mind. So here you have a healthy bronchial tube, and as you can see, it's fine, and there's no restriction and air is flowing normally. But when you have bronchitis, it's inflamed and there's also a buildup of mucus. So some symptoms are when you cough, you get mucus production, you get tired, there's shortness of breath, you get a slight fever, and chest discomfort. So the way doctors test this is you do a chest x-ray, a pulmonary function test, or a spit test. So treatments are cough suppressants, but only if you're not producing mucus, because if you are producing mucus, coughing is the body's reaction to try to get the mucus out. And if you take cough suppressants, then you won't cough. You take pain relievers, humidifiers, and bronchodilators, which will just make the bronchial tubes bigger so airflow is improved. And yeah, the way you prevent it is you just stay healthy, basic hygiene, wash your hands, shower, bathe, things like that. And moving on to my last one, for my digestive system, I decided to do appendicitis. So here you have a diagram of the general digestive system. So you have your large intestine and small intestine, and right where your small intestine and large intestine meet, in the bottom right quadrant of your abdomen, is your appendix. And nobody knows what your appendix actually does. There's many theories, but what doctors do know is that the removal of it doesn't have any really bad effects. So here you have the large intestine and your appendix over here, and here is an infected appendix. So usually the cause of an infected appendix is there is something blocking the flow of bodily fluids. And what happens is in your large and small intestines, mucus is getting produced. And if mucus is getting produced in your appendix, then it's adding pressure. And if there's mucus, then bacteria can reproduce. And if bacteria is reproducing, then your body will start producing white blood cells to fight off the bacteria. And what that does is it creates pus. So now your appendix is getting full of all these fluids, and the pressure is getting higher and higher until it explodes. And what happens is when it explodes, what you can get is peritonitis, and that's the infection of your peritoneum, which is the outer lining of your abdomen, which can be fatal. So the way that doctors test this is they do a urine test, blood test, ultrasound, and doctors apply gentle pressure to see if there's any inflammation. The way you prevent it is there really is no prevention. You just have to eat healthy, and the treatment is usually, because doctors know it's not needed, they'll do a surgical procedure where they just take out your appendix, and that's really it.